Procedure. Make sure that the room lights are on before the patients enter the examination room. Consider the patient's age, as this can provide useful clues to what their problems might be given the known epidemiology of certain ocular problems. For example, a 47-year-old patient attending for their first eye exam for many years is likely to complain of presbyopic-related symptoms. Observe the patient's stature, walking ability, and overall physical appearance. Pay particular attention to any head tilt or obvious abnormalities of the face, eyelids, and eye that will require further investigation, such as facial asymmetry, lid lesion, ptosis, epiphora, entropion, ectropion, a red eye, or strabismus. You should sit about 1 meter from the patient at eye level. Your posture and style should be relaxed but attentive. Lean slightly forward towards the patient. Try to avoid long silence while writing notes, and learn to write down answers in abbreviated form, as the patient is talking while retaining intermittent eye contact. 5. Chief complaint or reason for visit. Determine the chief complaint by asking a general open-ended question such as, do you have any problems with your vision or your eyes? Or, is there any particular reason for your visit, Mr. Smith? In a patient who reports no problems to the questions above and is attending for their regular annual examinations, ask the following questions. If the patient wears glasses, ask if you are unsure. You need a complete description of them. This may include, when do you wear your glasses? How is your distance vision in your glasses? Follow up by, do you feel it as good as it was when you first got them? This can be adapted to suit the patient. For example, a student could be asked, any problem reading from the whiteboard? And is everything clear on the TV? Any problems with reading with the glasses? How is your distance or near vision without glasses? How old are your glasses? How many pair of glasses do you have? Where did you get these glasses from? Or how old were you when you first wore glasses? Do you have prescription sunglasses? If you are unsure, ask if the patient wears contact lenses. If they do wear lenses, even if only occasionally, then you need a complete description of the contact lenses. What type of lens are they? Soft, gas, and brand if known. Two, if relevant, that is not single-use lens, how often do you replace your lenses and what care solutions do you use? How long do you usually wear the lenses each day and how many days per week? The first questions can be confirmed by asking when they typically put their lenses on and when they typically remove them, as average wearing times are typically underestimated. How many hours of comfortable wear do you get with your contact lenses? How is your vision with contact lenses? And how does it compare with the vision you get with your glasses? If the patient wears both glasses and contact lenses, you will have to ask about visual symptoms for both forms of corrections. Are you having any problems with your contact lenses currently? When was your last contact lens aftercare? And when is your next aftercare check scheduled for? A patient who does not wear glasses or contact lens should be asked about the clarity of the distance and near vision. Complete a symptoms check by asking about the most common symptoms. Have you experienced any of the following: regular or severe headaches, eye strain, double vision, any pain or burning discomfort in your eyes, any flashes of light or floaters, any other symptoms connected with your eyes or vision? Patients reporting visual symptoms. See recording example. With some patients, you may get a good description of their problems during the discussions of the chief complaint with little prompting. However, you are unlikely to obtain all the information you require, so you will have to ask some questions to fill in the holes of what the patient has told you. If you have not already been told, you must first find out whether the symptom occur with or without the patient glasses or contact lenses. If they have several pairs of glasses, you need to determine whether the symptoms are better in one pair compared to the others. Subsequent information required regarding the chief complaint is described below to provide a reasonable mnemonic logc for students, rather than a logical questions set and sequence for all symptoms, and with experience you will likely ask questions in a different order. Some example questions are provided for symptoms of blurred visions, headaches, and diplopia. A. Locations. L. For location or laterality. Example: is it more blurred in one eye, or is it the same in both? In which part of the head is the headache located? For a frontal headache, ask: is it above one eye more than the other? Is the double vision in all directions of gaze or just one? B. Onset 0, onset O. How did you first notice the blurred distant or blurred distant vision? When did the headaches start? How long have you had double visions? C. F. Frequency or occurrence. Example: how often do you get headaches? Prompt if the patient is unsure: every day, once a week, once a month. Are they any better on weekends? Do they tend to occur at a particular time of the day, morning mainly or evening? How often do you get double visions? How long does it last? Does the double vision occur after a lot of reading or at any time? D. Type. T for type. Example: did the blurred vision start suddenly or gradually? If sudden vision loss, ask what was the vision loss, partial or total? Is it a throbbing, sharp or dull headache? Is the double vision on top of each other or side by side? S. Self-treatment and its effectivity. How did you cope with the blurred vision, especially by squinting, possibly by squinting, sitting at the front of the class, sitting close to the TV, using ready readers, borrowing a family member's glasses, etc.? Does anything makes the headache go away? Do you take any painkiller for the headaches? Does the double vision disappear if you close one eye? E. The effect on the patients. How is your son's schoolwork progressing? Does it affect your hobbies or sport? Is your poor vision affecting how well you can do your job? Have you restricted your driving? How well do you manage driving at night? How badly do the headaches affect you? Have you been to see your GP about the headaches? A. Associated factors. Are there any other symptoms associated with the problem? A. Completion of information gathering for a patient with a chief complaint. Once detail regarding the chief complaint have been gathered, you then need to ask about visual issues not yet discussed. For example, you complete the question set in point 6. If a patient has a chief complaint of headaches, once you have a complete description of the headaches and whether they are better with or without any glasses or contact lens, you need to ask for the use of glasses and or contact lenses, distance vision, near vision, eye strain, pain or discomfort, and diplopia. If a positive response to any of these questions is obtained, you then need to obtain a complete examination. 9. Ocular history and family ocular history. A. If you do not already know, ask the patient where was their last eye examination. Ask whether the patient has had any previous eye injury, infection, surgery, or treatment. Follow up with positive response by asking the patient how old they were at the time, who managed the condition, and over what period and what treatment they received. For example, if a patient indicates they have amblyopia, discover the age they were diagnosed, and whether and what time they had an eye patch, eye exercise, glasses, or surgery. Family ocular history. An open-ended question such as, has anybody in your family has any eye problem or disease, should be asked. This can be clarified by providing example of common hereditary condition in lay terminology for their age, gender, and race if pertinent. For example, ask about any family history of cataract, age-related maculopathy, and glaucoma for patients over 60. Glaucoma for patients over 60. Glaucoma for black patients over 30. Short-sightedness, squint or lazy eye with children. Color visions for male patients attending their first eye exam. General health information. How is your general health? And add a follow-up question such as any high blood pressure or diabetes. If you receive a positive response, ask the patient how long they have had the condition. For some conditions such as diabetes and hypertension, ask whether the condition is well controlled. B. Do you take any medication? If so, receive a positive response, ask the patient how long the medications have been taken, the present dosage, and the number of tablets taken per day. Any allergy? Vocations. Sport, hobbies, computer use, and driving. Determine the patient's visual demand, including the safety hazard, protection for the patient's vocation, as well as the sport and hobbies. Summarize the case history. Summarize the pertinent information from the case history and allow the patients to clarify any misunderstanding on your part or to add any additional information that has been missed. For example, so Ms. Wilson, the main reasons for your visit are that reading has become a little difficult, even with your glasses, and that you particularly want me to perform all the glaucoma diagnostic tests because your mother has glaucoma. Is that correct? Remember that the case history continues throughout the examination. Certain signs or test results during the examination may suggest the need for further questioning.